companies are now denying death benefits to families if their loved ones die from COVID and were not vaccinated at the time of their deaths.
Michelle Andrews with Kaiser Health News joins us now to tell you what you should know about these new policies. Good morning. Thanks so much for being with us. A lot of people see this policy and their first reaction is, what if I have a medical or religious exemption?
Well, I think that this is something that is going to be determined on a case-by-case basis. I know in the case of the MTA, I think they said they'd had 5 people who've died since they changed their policy, and they, as far as I know at the time, hadn't heard from them. So I think it's going to vary, perhaps.
So the NTA, like you were just talking about, that's the highest profile employer to deny death benefits. So can you walk us through that new policy?
Sure. Well, the policy itself started in April of 2020 when we here in New York were at the height of the pandemic. And, you know, the unions and the MTA agreed to give workers a $500,000 death benefit if they died of COVID. And that's a, pretty generous benefit. But now, over a year later in June, the MTA changed the policy and said, if you're not vaccinated and you die of COVID, then you're not going to be eligible for that very generous benefit.
Is this only related to acquiring, contracting COVID on the job? And if so, how would they determine that?
Well, that's a really good question. And, they really can't determine it. And so, how do you know whether you caught it when you were, at the grocery store or on the job? But what they determined with this policy, and it happens elsewhere with sort of accidental death policies, frontline workers, the program may say, we're just going to presume that they caught it on the job. And that's what happens here.
So what do you imagine for the future? Do you think we can expect more employers to implement similar policies?
It's really hard to say. When I was doing the reporting, I didn't hear of a lot of companies that were putting similar policies in place. I think it's pretty uncommon. But, if people aren't getting vaccinated, maybe that's something that they'll consider.
Needless to say, COVID vaccinations have been among the most divisive topics in the country. What's been the reaction to this policy being rolled out?
Well, I think certainly union members and the organizers are really proud of the policy themselves. That they got that, they negotiated that with the MTA, and they're pleased about that. As for taking it away, that's going to vary. I think employers are frustrated in many cases that, there's this vaccine out there and it's really effective, and a lot of times their workers just don't want to take it. And so maybe this is an extra incentive.
Right. All right. Michelle Andrews, thank you so much for joining us with Kaiser Health News.
Thank you.